All right, ready to dive in. Today, it's all about cardiac output.
You know, how much blood your heart pumps out each minute.
Yeah, whether you're hitting the books for med school or just curious about what's going on in there.
It's fascinating. Most people don't think much about it.
Right, it's like a hidden hero. So, what exactly is cardiac output?
Well, we call it CO for short. It's basically the volume of blood your heart pumps out every minute.
Okay, but how much are we talking? Like, give me a visual.
Think of it this way. The average person pumps about 5 liters a minute.
5 liters.
Yeah, like a gallon of milk every 60 seconds.
Whoa, that's more than I thought. And fast.
Your heart circulates your entire blood volume in a minute.
Wow, okay. But why is understanding the CO number important?
Well, it's like a baseline for your heart health.
Ah, okay.
Doctors use it to see how well your heart's working.
Makes sense.
And it's crucial for understanding things like how your body gets oxygen to your tissues.
Oh, so it's not just about how hard it works, but how well, too.
Exactly. And it even helps calculate resistance in your blood vessels.
Which tells us about blood pressure and all that?
Exactly.
Oh, seeing how it all connects. But how do we measure it? Seems complicated.
It's actually pretty simple. It's your heart rate, beats per minute.
Yeah.
Multiplied by your stroke volume.
Stroke volume?
Yeah, the amount of blood pumped with each beat.
Right. So if my heart's beating, say, 70 times a minute, and each beat pumps out what's normal, again?
Normal stroke volume's about 60 to 130 milliliters per beat.
Okay.
So if yours is, say, 95, then your output would be about 6.6 liters per minute.
Okay, my heart's a busy little thing. Is that good, though? How do we know if it's healthy or not?
Well, the average is 5 liters, but a healthy range is 4 to 8.
Okay.
And, of course, your age, gender, body size, all that matters.
Right. We're not all the same, so how do we account for those differences?
We use something called cardiac index, or CI.
CI.
Yeah, it adjusts for your body size, levels the playing field.
I like that. So it's not just the volume, it's how efficiently it's circulating.
Exactly.
How do we calculate that, then?
You take your cardiac output and divide it by your body surface area.
Which is basically height and weight. Okay,
Yep.
Makes sense. What's a good cardiac index, then?
A normal range is between 2.5 and 4.0 liters per minute per square meter.
All right. So we've got CO and CI, but what about this stroke volume? What determines how much gets pumped out with each beat?
3 main things. Preload, afterload, and contractility.
Okay, break it down for me. What's preload?
Preload is how much your ventricle stretches before it contracts, like filling a balloon.
More air, more stretch.
Exactly. More blood in the ventricle, more stretch, more preload.
Got it.
And there's this thing called Starling's law.
Starling's law.
Which says the more it stretches, the stronger the contraction, like a rubber band.
Ooh, the heart's a rubber band. Okay. You mentioned other things affect preload too, right? Not just the blood.
Yeah, your position, vein tension, pressure in your chest, all that can affect how much the ventricle stretches.
Okay, that makes sense. So that's preload, the stretch before the pump. But what about when the heart actually starts to contract? What else comes into play?
Well, that's where afterload comes in.
Afterload.
It's basically the resistance your heart has to pump against to get the blood out.
Ah, okay.
Like squeezing a tube of toothpaste. The harder it is to squeeze, the more resistance.
Okay, so a stiff tube equals higher afterload. Makes sense. What can affect that?
Well, things on the heart side, like how much blood's already in there, pressure in your chest, even heart muscle size, but also what's going on in the blood vessels.
You mean vascular resistance?
Exactly. How easily blood flows through. Like, think of your blood vessels as highways.
Okay.
And SVR, systemic vascular resistance, is like traffic.
Oh, I like that.
More congestion, more resistance, the harder the heart works.
So constricted vessels, high traffic, high resistance. Dilated vessels, smooth sailing, low resistance.
Exactly. And things like exercise and stress can affect that.
It's all coming together. So preload is the stretch before, afterload is the resistance during. What about that third thing, contractility?
Contractility is the heart's inherent strength, like a gentle push versus a powerful punch.
Ooh, I see. So a strong heart has higher contractility.
Yeah, but it's not just muscle mass. It's also affected by that stretch we talked about, preload,
right,
and the heart's inotropic state. Basically, how responsive the muscle is to signals to contract. Hormones and meds can affect that.
Wow, this is fascinating. I never knew how much went into each beat. Maybe we could take a little pause here. My brain needs a moment to process all this.
Sure. When we come back, we'll see how it all ties together for cardiac output, and we'll delve deeper into those resistances too.
Okay, back to cardiac output. Before the break, we were talking about what affects each heartbeat. Preload, afterload, contractility. It's a lot.
It is a symphony of actions. And speaking of complex systems, we can't forget about systemic and pulmonary vascular resistance.
Right, you mentioned those. Sound important. What did they measure exactly?
Well, think of it like this. Your heart has two main jobs.
Right.
It pumps oxygen-rich blood to your body, systemic circulation.
Yeah.
And it pumps oxygen-poor blood to the lungs to get more oxygen, pulmonary circulation.
Two different circuits.
Yeah. So systemic vascular resistance, SVR, measures the resistance the heart faces when pushing blood out to the body.
Okay.
Like, imagine pushing water through a hose. If it's narrow or kinked, there's more resistance.
Makes the heart work harder.
Exactly. Now, pulmonary vascular resistance, or PVR, measures the resistance in the blood vessels of the lungs.
Okay.
So think of your lungs like a giant sponge. PVR is how much resistance the blood faces as it squeezes through to get oxygen.
So SVR, left side of the heart, and PVR, the right side.
You got it. They tell us how hard each side is working.
Makes sense. But how do doctors actually measure those resistances? Is it like a blood test?
It's a little more involved,
Yeah.
but the idea is pretty simple. For SVR, you compare the pressure in your arteries to the pressure in the veins going back to the heart.
Ah, the difference tells us how much push the left ventricle needs.
Exactly.
What are the actual measurements used, though?
We use something called mean arterial pressure, or MAP, for the average pressure in the arteries.
Okay.
And central venous pressure, CVP, for the pressure in the veins leading to the heart.
So pressure difference between arteries and veins, and then factor in the cardiac output to get the resistance.
Precisely. A normal SVR is usually less than 20 millimillion HGLmin, or 1,600 dynes if you use another unit.
Dynes. Sounds like physics.
It is another way to express it.
Yeah.
But the point is, anything higher could mean more resistance, making the heart work harder.
So high SVR is bad news. What about PVR? How's that one calculated?
It's similar to SVR, but with different pressure points.
Okay.
We look at the pressure in the pulmonary artery, pulmonary artery pressure, or an MPA, and compare it to the pressure of the lung capillaries, pulmonary capillary wedge pressure, or PCWP.
That gives us the resistance for the right ventricle.
Right. Same idea, different parts of the system. So what can mess these resistances up?
Yeah, what throws them off?
For SVR, high blood pressure or hypertension can increase it.
Right.
Anything narrowing the blood vessels, vasoconstriction, does the same.
Okay.
Then low blood pressure, hypotension, or anything widening them, vasodilation, decreases SVR.
So it's all about blood flow. What about PVR? Similar stuff.
It is. Hypoxia, when your tissues don't get enough oxygen, that increases PVR.
Right.
Pulmonary hypertension, high blood pressure in the lung arteries, that does too.
Okay.
And some lung diseases that affect the lungs themselves can also impact it.
This really shows how delicate this balance is. Heart, lungs, blood vessels, all working together. But you mentioned other things affect cardiac output besides those resistances.
Oh, yeah, definitely. Like your metabolic rate, how much energy your body's using.
Okay.
And how much oxygen you need depends on that.
Right. More energy, more oxygen.
So the more energy your body needs, the more blood your heart pumps.
Like a bigger engine needs more fuel. So if I exercise, my cardiac output goes up.
Exactly. And it's not just exercise. Fighting an infection, surgery, even strong emotions, anything that increases your metabolic rate.
Wow, my body's adjusting it all the time. Are there other things too?
Yeah, for example, females actually have slightly lower cardiac output than males of the same size.
Really?
About 10% less.
I wonder if that's because of muscle mass or something.
That's a good thought, and probably right. Muscle burns more calories, so it makes sense they might need higher output.
What about size in general? Bigger bodies need more to supply all that tissue, right?
You're absolutely right. That's why we use cardiac index. It accounts for size.
Levels the playing field. What about age? Does it change as we get older?
It does. Cardiac index is highest in childhood and decreases as we age.
Makes sense. Kids have all that energy. What about, posture? Does that affect it?
It might surprise you, but when you stand up from lying down, your cardiac output can drop by 20%.
Really? I'd think standing would make it work harder.
It seems counterintuitive, but it's because of gravity and blood flow.
Ah, okay.
When you stand, blood pools in your legs, which can temporarily decrease the amount going back to the heart.
Fascinating. Okay, so we've covered a lot, from basic definition to all these factors, but why measure it in, a hospital? What does it tell doctors?
It comes down to perfusion status.
Perfusion status.
How well blood is reaching the tissues and organs, making sure they get oxygen and nutrients.
So cardiac output shows how well the body's being nourished.
Exactly. And here's the key. Cardiac output can drop before blood pressure even changes much.
Oh, so it's an early warning system.
Yeah, doctors can catch things early.
That makes sense. How do they measure it, though? It seems complicated.
There are a few different methods, each with pros and cons.
Okay.
3 common ones are dilution, thermodilution, and the Fick method.
Dilution, what's that?
They put a catheter into a vein, usually in the pulmonary artery, then inject dye into the bloodstream. A sensor downstream measures the concentration of the dye as it passes by.
So they track the dye's flow.
Right. And by looking at the dye concentration, we can calculate cardiac output.
Okay. What about thermodilution? Is that different?
It's a little less invasive. They inject cold saline into a catheter in the pulmonary artery.
So instead of dye, it's a temperature change.
The catheter has a sensor that detects the temperature drop from the saline. And by looking at how the blood temperature changes, we get cardiac output.
So it's like dye dilution, but with cold saline. What about that Fick method? You said it's the most accurate.
It is, but it's also more complex.
Okay.
It's based on the idea that the oxygen your body uses must equal the oxygen the blood delivers.
Right.
So we measure the oxygen the body's using and compare it to the oxygen levels in the blood. By looking at the difference between arterial blood going out and venous blood coming back, we see how much oxygen the blood delivered. And from there, we can calculate cardiac output.
Wow, that is more complex. But it makes sense why it's the most accurate. It looks at the whole picture.
Wow.
This is amazing. I never knew how much goes into figuring out how much blood our hearts pump.
It is pretty incredible. And it shows why measuring cardiac output is so important for overall health.
Totally. We've covered so much. But there's probably even more to learn, right?
Definitely. We'll wrap up our deep dive into cardiac output after a quick break.
And we're back, wrapping up our deep dive into cardiac output. It's been a fascinating look at the force that keeps us going.
It has. We've really gotten into the details of what affects how much blood our hearts pump out and how doctors actually measure it.
You know, before the break, we were talking about how even standing up can change our cardiac output.
Right. It's a great example of how adaptive our bodies are.
Yeah, it's pretty amazing. Makes you wonder what we can do to, help the system out in our daily lives.
That's a great point. We've talked a lot about the medical side, but there are definitely things we can do ourselves to keep our hearts healthy.
Okay, give me the tips. What can we do?
Well, first off, regular exercise is key.
Makes sense. Get the heart pumping.
Exactly. When you exercise, your heart muscle gets stronger and more efficient. Like any muscle, the more you use it, the better it works.
Makes sense.
Plus, exercise helps with blood flow and blood pressure, all good for cardiac output.
So getting that heart rate up is a good thing. What else?
Keeping a healthy weight is huge, too.
Right. Less weight, less work for the heart.
Exactly. Extra weight puts a strain on your heart.
Okay, makes sense. What about diet? I'm sure that plays a role.
Big time. What you eat affects your heart health directly.
Ah, okay.
A diet with lots of fruits, vegetables, whole grains, lean protein that gives your heart what it needs.
So good fuel for the engine.
Exactly. And limiting things like saturated fat, trans fat, cholesterol, too much sodium, that helps with blood pressure.
It's all about those healthy choices. Anything else?
Oh yeah, stress management is super important.
Stress is bad for you. We know that.
It is, especially for your heart. When you're stressed, your body releases hormones that raise your blood pressure and heart rate, making your heart work harder.
So finding ways to relax can actually help our hearts.
Absolutely. Exercise, meditation, being in nature, hobbies, anything that helps you de-stress.
Right. Taking time for yourself. And we can't forget about sleep.
Definitely. Not enough sleep. And your body pumps out more of those stress hormones, leading to higher blood pressure and heart rate.
So we need to let our hearts rest too.
Exactly. Aim for 7 to 9 hours of good sleep every night.
It's amazing how these everyday things affect something as important as cardiac output.
It really is. Shows how connected our bodies and minds are. Taking care of yourself overall is the best way to support your heart.
I think we've learned so much in this deep dive. We've looked at how cardiac output works, what affects it, and even how we can help keep our hearts healthy.
Absolutely. I hope everyone listening has a better understanding of this vital function and feels empowered to take care of their heart health.
I know I do. So, as we wrap up, we want to leave you with a challenge. What one small change can you make today to support your heart? Maybe a walk, or choosing water over soda, or just taking a few minutes to breathe and relax. Every little bit makes a difference.
And remember, knowledge is power. Understanding how our bodies work lets us make choices that support our health.
Well said. Thanks for joining us on the deep dive, everyone. Keep those hearts healthy and pumping strong.